Welcome to Quality Brights, brought to you by the Quality Improvement Team at Bradford Teaching Hospital Foundation Trust. This is one of our series of bite-sized training videos for BTHFT staff. Each video introduces a quality improvement topic or tool which can be used to support quality improvement projects across the Trust. This Quality Bite is going to focus on our foundation level training, which will give you a basic understanding of what we mean when we say quality and quality improvement. Our aim is to deliver this level of training to all staff at Bradford Teaching Hospitals, as QI is part of everyone's role. It's not just for managers or senior staff. Anyone can have an idea about how to improve the area they work in, and we want you all to have a basic understanding of how improvement works. At the end of this video, there will be a short test, and upon completion, you will receive your foundation level training certificate. Please take care when entering your details, as an incorrect spelling of your email may result in you not receiving your certificate. We ask, where possible, that you use your work email address for this purpose. Starting with the patient in the centre, ask yourself, what is important to a patient attending Bradford hospitals? Try to put yourself in their shoes, or think about an experience you can draw upon about care you may have received at some point in your lifetime, or that of a friend or relative. We're going to pause for a minute to think about that situation. What was it that made it a good experience or a poor experience? Here at Bradford, we use the following 4 elements to describe quality healthcare, namely patient safety, clinical effectiveness, patient experience and staff experience. Patient safety should be the bedrock of all care we deliver. It is about the avoidance of unintended or unexpected harm to people during the provision of healthcare. Clinical effectiveness is about applying the best knowledge derived from research, clinical experience and patient preferences to achieve optimum processes and outcomes for our patients. Patient experience encompasses the range of interactions that patients have with the healthcare system, and it's really about the process of what receiving care feels like for your patients. Finally, at Bradford, we also consider staff experience to be an important element of quality. We want all our staff to feel satisfied with the quality of work and patient care they are able to deliver. We also know from research that staff who become inspired to be the best people they can be at work deliver better patient care. So starting at the top of our little diagram, our quality processes start with learning. We want to learn through a collaborative approach by sharing experiences and knowledge. We want to learn when things go wrong as well as when things go right. We want to encourage an open culture to speak up when things go wrong. It is through this learning that we are able to identify areas for improvement. So we move round our little diagram into quality improvement. Here at Bradford, we use a scientific approach to bring about change. We use the IHI, that's the Institute for Healthcare Improvement, model for improvement as our methodology, which will be discussed in greater detail on the next slide. But essentially, it's about using data to support the implementation of changes. Finally, we have assurance. This will tell us whether we are working towards our standards. It's about looking at how we are performing and whether there is room for improvement. Through identifying learning opportunities and the use of the model for improvement, we can gain assurance that we are delivering quality healthcare. We are trying to move away from an assurance-led quality system to one that is led by learning and improvement. There are many different improvement models available. However, our chosen one is the model for improvement. There are 4 steps, 3 questions followed by small tests of change. Step 1, understanding the problem and what it is we are trying to accomplish. This is arguably the most important step. If we do not understand the problem, then it is very unlikely that any changes we propose will result in an improvement. There are various tools we can use to help us understand our problem, such as fishbone diagrams, process mapping, or Pareto charts, to name a few. There are bite-sized videos describing these and other elements of the model for improvement on our intranet pages. Once we understand what it is we wish to achieve, we then set a SMART aim. SMART stands for specific, measurable, achievable, relevant, and time-bound. Moving on to step 2, how will we know whether a change results in an improvement? The only way to know this is to measure. There are 3 different types of measures we use in the model for improvement. First of all, we use outcome measures. These are directly related to the aim and measure whether we are on track for meeting our SMART aim. All projects should have an outcome measure. Process measures. These are often related to tasks within the process. For example, the number of assessments undertaken. It helps us know if the care is being applied correctly and we're doing the things that we're supposed to be doing. We always recommend that improvement projects have 1 or 2 process measures. And finally, we have balancing measures. These allow us to measure any impact on other areas as a result of our improvement work, and these can be negative or positive. A balancing measure might be more tricky to identify initially, and we always say not to worry if you don't have one. Let's try and use falls as an example. Your outcome measure might be the total number of falls on a ward or number of fall-free days the ward achieves. Your process measure could be the number of falls assessments completed. A balancing measure might be something around monitoring the number of call bells, as you might see an increase in this. On to step 3. What changes can we make that will result in an improvement? These are your tests of change, and remember, no idea is a bad idea. We can get these ideas from a variety of places, but we always encourage you to involve your whole team and, where possible, patience in generating these ideas. The final step, step 4, is to perform small tests of change known as Plan, Do, Study, Act, or PDSA cycles. Plan what it is you are going to do and ensuring all relevant people are aware of this. The do is the part when you put the change into practice. The study is probably the most important part of the PDSA, as this is our learning. Remember, even if something doesn't work, it hasn't been a waste because we have learned what doesn't work. Finally, we act. Evaluating the results of your change test will help you make the decision of whether to adopt, adapt, abandon your PDSA. What you may find is that each PDSA brings an element of learning that you can use to help build the next PDSA, and you could end up with a few cycles that branch off one another, resulting in a change idea fit for purpose. Remember, improvement is part of everyone's role and anyone can do it. This brings us to the end of our Foundation Training Quality Bite. To recap, you should now be able to describe the 4 elements of quality healthcare we have adopted at Bradford and have a basic understanding of our QI methodology, the model for improvement. We would now like you to either click on the link below or scan the QR code to take you into a short assessment. There are 5 simple questions and you need to get 3 out of the 5 correct in order to get your certificate. We hope you have enjoyed this session. For more information, or if there is anything you'd like to explore further, please drop us an email at quality.improvement@bthft.nhs.uk or check out our intranet pages via the link below. Bye for now.